and Emergency Preparedness Coordinator for Itasca County. Itasca County is hosting press briefings to highlight themes emerging in our community related to COVID-19. Today, we are joined by David Pace, Superintendent of Independent School District 316 and Chair of the Itasca Area Schools Collaborative. We are also joined today by Dr. Dan Sular, Vice President for Medical Affairs and Family Physician, Grand Itasca Clinic and Hospital. We're also joined by our local and regional media. After our speakers, please submit questions via the chat function. And we ask that you preface your questions with your name and the media organization you represent, and our panel will respond to the questions that pertain to their organization. Before we move on to our speakers, I will provide a situation update on COVID-19 numbers in Itasca County. We have 208 laboratory confirmed positive COVID-19 cases in Itasca at the time of this briefing. We remain at 12 deaths in the county since the beginning of this pandemic. We have reported the positive cases as soon as we learn of them to stay ahead of the numbers for you as our community, with the goal of providing as much updated information as possible. We continue to work with the community and our partners to practice safety measures of encouraging masking, washing hands with soap and water, covering coughs and sneezes, staying home when you're sick, and practicing social distancing to help slow the spread of COVID-19. Public health staff continue to respond to questions via the Itasca County COVID-19 information line, and that number is 218-327-6784, and staff are responding to messages Monday through Friday, 8 a.m. to 4:30 p.m. So recently, the Minnesota Department of Health Commissioner Jan Malcolm said that Minnesota has been walking on a ledge when it comes to our COVID-19 numbers. And Itasca County is also at a place where we could tip into the direction of uncontrolled spread of COVID-19. And we do not want that, especially as schools are about to start, and pretty soon we will no longer have summer weather to gather outside with our friends and family. And so we will be forced to be more in an indoor environment. The Labor Day weekend is also coming up here in a couple of days. And we just want to remind people to practice measures that help reduce the spread of COVID-19 when we are gathering. So if we take a look back at the July 4th weekend, we saw a surge of cases in the 2 weeks following that holiday. And we want to try to avoid that with Labor Day as much as we possibly can, especially at this time of year with school starting. So the focus of today's briefing is frequently asked questions from our community members. And one of those common topics lately is around schools. And so our schools are doing a great job of providing information to parents, teachers, staff in the community. And we've asked David Pace, Superintendent of ISD 316, to respond to some of those common COVID-19 questions that the schools are being asked. So I welcome David Pace.
Thank you. You know, as we look forward to this school year, we've got many schools that are opening in different modalities throughout the region. In Greenway, our opening was delayed till September 14th, mainly due to construction. It had nothing to do with virus spread within our community. But I know Grand Rapids is starting in person, Deer River is starting in a hybrid model, and Nashwauk-Keewatin is starting in a alternate day setting and then coming in person on the first day of the week. You know, it is important that as we open this school year, you know, it has been emphasized, and I know it's a question that will probably come up today, of course, is the mask mandate and associating with that. It is, you know, it is a mandate that has been handed down by the governor. We are a public institution, and we know that it is very effective in reducing the spread of COVID-19. Yes, there are some exceptions specifically within different lessons, but that is a short period of time, specifically if we're talking about phonics and mouth movements and things like that, where a shield can be used. But there are a few developmental medical exceptions in which a student would wear a mask. Now, different schools are addressing different ways, but we're requiring a mask, and if you fall into one of those categories, it would be a shield. We also have some other protective devices, desk shields for staff, clerical, going forward. So we are preparing for many different avenues, and we all know that this is a cooperative effort. What happens outside of the school at some point in time is we have to be as safe. If we aren't going to be safe outside the school community, we know it is going to have an impact of our schools.
Thanks, David. So another common question is, how are schools monitoring, and how can you tell the difference between COVID-19 and the common cold or influenza?
Those are one of the things that, we're asking our parents to take an active, and we've provided the latest decision tree that just came out. We have to update that information to our parents, which is a little more complicated for parents to follow. So there is going to be education, with that. We also are going to do visual screening of every student that comes in different doors. So we are having more open doors throughout our school community. So there will be visually screening. We ask that parents take the temperatures of students before they come to school. So that, again, that's one of those cooperative things that parents need to be aware of their students' health. And if that student has, one or more symptoms that have been listed, we encourage them to take the safe route, and if there is a concern on their part, if they have to ask the question, keep the student home. We do, in our buildings, we will have an LPN in each building, plus we have our district RN nurses that will be addressing individual students if they come into the building with more specific symptoms. And a lot of our neighboring districts are doing the same thing. We're hiring additional staff, health professionals to be on site, and plus specifically working with our Itasca County Public Health and our regional support teams.
Thanks, David. So that actually you just answered one of our other frequently asked questions: is, are schools prepared if teachers get sick? Is there anything else you'd like to elaborate on for that question?
Well, yeah, when we look at our school community is not just students. We are looking at different avenues. We do have substitute teachers, and we're asking our teachers to do the same screenings along with some of the subs that we do have. We do have alternate plans, though, if a group of teachers get sick, to provide some telepresence. If that student or teacher is under quarantine for a period of time, we would be able to get a substitute in the classroom and maybe potentially have that teacher broadcast into that classroom. So each district is taking different modifications. Some districts are looking at hiring permanent subs to have additionally on staff. We're hoping that through the process of in-person subs and remote access that we can keep things going as much as possible if there is an outbreak.
All right, thank you, David. So that leads us to some common medical questions, and we've asked Dr. Dan Sular, Vice President for Medical Affairs and Family Physician at Grand Itasca Clinic and Hospital, to help us out with these. So Dr. Sular, how can we tell the difference between COVID-19 and influenza or the common cold?
Thanks, Kelly. Thanks, Anna. Sorry. That's a really good question. And it's a really good question because these illnesses are very, very similar. They share a lot of the same symptoms, including fever, cough, shortness of breath. One of the interesting symptoms that COVID has that we don't see in influenza is the loss of taste or smell. So that could be very helpful. But to be honest, outside of that, these overlap very well. Influenza, COVID, and other common respiratory illnesses are all caused by viruses. So the similarities are there and very real. And so, as Mr. Pace was mentioning, when in doubt, and if they are ill enough to be seen by a provider, certainly us and the other medical providers in the region would be happy to see them, test as appropriate, and go from there. Some differences that do exist between COVID and influenza include treatments. So for influenza, we have well-known FDA-approved treatments that work very well. They're well tolerated. For COVID, there is no FDA-approved treatment right now. There are many items we're using. There's an antiviral, there's plasma that we're using under emergency use authorization. But, again, we've been using this for a few months, and the data to support these long-term just isn't there. So that's a huge difference between the two illnesses. And then finally, I want to put a plug out for vaccines. It is coming up to flu vaccine season. That is one tool we have to help prevent influenza in our community. And the vaccines just don't exist for COVID. Despite what is being said in the news, we don't know when the vaccines will be available. The best case scenario is probably early 2021. So we're going to be vulnerable for the first few months of the school year. And so what we've been telling our patients is, get that flu vaccine, get it early, so at least we can protect our community from that terrible respiratory illness.
Thank you. And thank you for mentioning the flu vaccine. That's very important. And so when should a person go get tested for COVID-19?
Yeah, because COVID-19 is significantly more contagious than influenza, we're recommending, if you have symptoms, cough, shortness of breath, fever, aches and pains, fatigue, loss of smell, that you get tested. That way we can know if you are positive, we can quarantine and help prevent the spread. And, so I can speak for us at Grand Itasca. If you have any of those symptoms, you can come get a curbside test. We usually have the results within about 3 days. And so, again, when in doubt, get tested.
All right, thank you, Dr. Sular. So another common question that we get at Itasca County Public Health is, what does contact tracing involve? So Itasca County staff have been trained in this. We've been doing case investigations and contact tracing since July. And so the purpose of case investigations and contact tracing is really to provide education and guidance to anyone who recently tests positive, or if they've had close contact with an individual who has tested positive. And then the ultimate goal of this is to decrease illness and decrease spread of COVID-19 in the community. So the process, what it entails is, so if you test positive, that is electronically reported to the state of Minnesota, the Minnesota Department of Health, because it is a reportable disease. And once we are able to see that on our end at local public health, the person receives a phone call from a staff member. And the purpose of this call is to, again, provide education for you, to make sure you can help monitor your own illness, provide guidance for things such as when it is safe to go back to work, when it's safe to be around others again, and how to decrease the spread. And so that process generally takes around 20 minutes or so. The purpose is not to check up on people to make sure they are in isolation or quarantine. It's really just to provide that layer of support for you, so you can help manage your illness and prevent the spread. There are a couple of special teams at the Minnesota Department of Health who also do these phone calls. So generally, someone from Itasca Public Health will give you a call. However, if you are a healthcare worker, or if you work or reside in a congregate living facility, your case will be assigned to a special team in St. Paul with the Minnesota Department of Health. And so you could get a call either from a local public health person or from someone in St. Paul. And so if you do receive a call from one of us, we really encourage you to answer that call. Most people find it very helpful for them. So public health in our county and the state are watching trends very closely, along with the schools. And so going back to David Pace, what can parents expect if or when school models change, and how and when will parents be notified of those changes?
As it's been mentioned, there is the weekly case rate that comes out by county, and as those will come out, I know that our plan here in Itasca schools, we would meet with public health and evaluate if there are specific pockets and develop a plan. If we are specifically going to change learning models, unless there is unless there is a specific building issue or things like that. Typically, most school districts' plan is that we would announce through our communication methods, our instant alert methods with parents to let them know that we are changing models and the rationale for that, to allow them at least 1 week to prepare for those changes. Now, we do know that there may be some specific incidents, that may happen within a building that may cause issues for more immediate change. But if we are going to have more of a system-wide, county-wide change in that, it would be a longer period of time for parents to make that adjustment.
Thanks. And also, David, on behalf of all the teachers and staff in our area, school do you have for Itasca residents and visitors?
School districts across Itasca County and the Itasca County Collaborative are, they're adding staff to make sure that there's appropriate cleaning, day to day. We're making sure that we're modifying our schedules to eliminate as many large congregate meetings that happen, such as in lunchrooms. We're changing our lunchrooms in our elementaries, where a lot of the students will be having classes or lunch in their classrooms. They're going to be going outside more for the mask breaks and things like that. So they're building alternate schedules, and they're also taking a look at how we move through the building and making sure that we don't have the large congregate of students in the hallways all at one time. So schools are doing as much as we can to make sure that we can open as safely as possible. So, and our staff have been working all summer long with school districts in additional time to prepare for all three models, whether they're providing distance learning to students or a hybrid model, which could be some students at home and delivering both models at the same time. So we've got a lot of cleaning that will be going on here in Greenway School District. We've added 3 custodial staff for additional deep cleaning, and disinfecting of every single desk every night. So a lot of that is happening through our schools, and we'll continue it all year long.
Thanks, David. So before we move on to questions from the media, I just want to review one other common question that we receive. So if someone is a close contact to a confirmed case, but they themselves do not have symptoms, what should they do? So we recommend that they closely monitor themselves for symptoms of COVID-19. We do recommend that they try to get tested if they are able to. And so what you can do is call the clinic that you decide to go to and see what their testing procedures are. We also recommend that you self-quarantine as much as possible while you're waiting for those test results. And also check the guidelines or protocols at your school or workplace for when you can safely return, because there can be some variability on when someone is allowed to return back to work. And in the meantime, we recommend that you wear a mask whenever you are around others, practice hand hygiene, and also practice social distancing. And then also, if you do not have symptoms, but you in the next few days go on to develop COVID-19 symptoms, you should notify your employer and stay home if you're able to. So that concludes our briefing, we are open to any questions from the media at this time. Jennifer Vale Stores from ICTV is asking, Dr. Sular, flu shots are currently available in some places already. When would you suggest people get their flu shot? Should we do it now or should we wait until later in the fall?
Yeah, thanks. That's a great question. I've also been getting quite a bit in clinic. I'll tell you, generally speaking, a lot of people like to wait until October or even November so that the flu shot can last through the entire flu season. There's some worry that it may wear off in March or April. However, this year, we are encouraging everybody to get the flu shot as soon as possible. So if historically you waited a little bit later in the fall to get your flu shot, I would definitely encourage you to rethink that and get it as soon as you can.
Thank you. Are there any other questions at this time? We'll give it just a few more seconds. All right, so it looks like, okay, we do have one more question, a follow-up question from Jennifer. So are flu shots available at Grand Itasca right now?
As of this morning, we do not have our supply. I would anticipate in the next 1 to 2 weeks, we should have our supply. I would also anticipate we will advertise that on all our normal social media channels. So keep your eyes open.
All right, thank you. Any other questions at this time? All right, well, seeing none, we will conclude this media briefing. Thank you everyone for joining us. Stay well, stay healthy, and be kind to one another.